Welcome to another episode of the Building a Bulletproof Back podcast. If we haven't met, my name's Marion McRae. I'm a physio and founder of the Bulletproof Backs method, which essentially is all about holistic back pain rehab. I created the podcast to have great chats like we're about to have with clinicians in the back pain space or clinicians who have something really cool to offer about back pain that we perhaps haven't already thought about. But also I talk to back pain sufferers who've made it to the other side and who like to share their experience and pass on some of their top tips. Joining me today, I have Dr. Emily Skipple, and Emily's work is really unique. She's a clinician and educator, I would say neurosensory expert. And really, her work is at the intersection of pain science, movement, the nervous system, feet, all of my favorite things, certainly. So, Emily, thank you for your time. What did I miss? Please introduce yourself to the listeners.
Yes. No, thank you so much for having me on and great introduction. Functional podiatrist, I love to underline that so people understand the perspective of which I'm looking at feet. So trained traditionally, did surgery, and now I do functional and regenerative podiatry.
Awesome. That sounds pretty awesome that you've started as a podiatrist, but really kind of expanded north of the feet. I think sometimes it's hard for people to understand that the whole system is intertwined in feet. But you clearly get it. Based on what you know, and you know so much, I like your work because I think you bring in threads from many other bodies of work. For back pain sufferers, would you have some key insights worthy of sharing that you think from your base and your knowledge base is something to pass on that they can benefit from?
Absolutely. So, as a podiatrist, our feet, or from the lens of a podiatrist, our feet are our body's foundation, and that could be a postural foundation. So, if our foot posture is not strong, we don't have good integrity in it, maybe we have flat feet, overpronation, that can cause a biomechanical chain of events up the lower leg to the pelvis, of course, to the lumbar spine all the way up to our skull. And that is essentially setting this postural foundation for the pelvis and into the lower back. That is one very, very powerful way that I think is the easiest to understand when it comes to the feet. However, I'm very into, as you alluded to, the neurosensory and a fascial side of our feet, where our feet actually influence the timing of how our deep abdominal muscles engage. That's important for low back stability. And then there are fascial pathways between the tips of our toes, through our lower leg, deep hip, pelvic floor, diaphragm, up our neck to our tongue. And that plays an important role in stability, dynamic stability. And it also sets the foundation for larger muscles to contract. So that's really how I start to set the stage as far as feet, mechanically, sensorially, right? And then fascially.
Mm. Beautiful, beautiful. And so if I'm in back pain listening, and I know my feet aren't optimal, or perhaps I've had previous foot issues, I guess, how does someone start to make the connection that something to do with their feet may be impacting their back pain? What are some just basic sort of ideas for them to start to think, wow, I wonder if that's relevant for me?
I think understanding your foot type, so your foot posture. This could be through going to a podiatrist, going to a professional such as you. I do have a foot type quiz on my website, which is
Oh, cool.
barefootstrong.com, and people can go through my foot quiz. And it's just understanding, do you have flatter feet? What does that mean? So fallen arches, overpronation, just what does that mean? And on a scale of all the flat feet, is it mild? Is it moderate? Do you have severe flat feet? Are your feet flexible? Are they rigid? So we're starting to foot type. Or do you have maybe a higher arch that's more rigid, a stiffer foot? That also can be associated with stress up into the lower back and into the spine. What does that mean? How do I start to address that foot? Or do I have a neutral foot, but it's less about the posture and the structure, and maybe it's something else. Maybe they're a neutral foot, but it's completely disconnected from the pelvic floor, which goes into some of the other things that I was talking about. So I would say for sure, baseline, anyone who's a low back pain sufferer is to understand your foundation. What's your foot type? What does that foot type mean? And what are some of the solutions? Do you need to bring in a little bit of support? Do we need to bring in strength? Do we have to bring in mobility? Or in most cases, it's a combination of all of those three things that you want to bring in.
Yeah, and it's usually customized for the person. I mean, as you would
Yes,
know, feet, even the left foot and the right foot can be usually are very different. So sometimes I see what the right foot needs is very different to what the left foot needs.
absolutely.
And yeah, you really need that customization. But would you say, let's say we've decided it's a foot that could do with some strengthening.
Mhm.
Um, barefoot strong techniques and barefoot strong foot to core, those sort of activities are really good.
Absolutely. So, what I teach before I teach foot exercises is I want everyone to understand how to create a neutral foot.
Hmm.
So, what does a stable base look like? And I'll share those features real quick with you. So, a
Hmm.
stable base or foundation in your feet has four components. First one is that it is balanced on its foot tripod. So, first met head, fifth met head, heel. The toes should be long, straight, and wide. So they're spread out in contact with the ground. And then we can actually do a little bit of a rotation in our hip. It's technically an external rotation, but it's a rotation in your hip that will lift the bone in the foot that is the arch. It's called a navicular, but it lifts that bone in the arch. And then the fourth one is what's called toe purchase. So, toe purchase is an activation or an engagement of your toes into the ground. I call it gripping the ground, um, anchoring into the digits. Technically, that exercise is called short foot.
Hmm.
And you can essentially go into further foot exercises, but you have to first create the alignment through which the muscles are going to contract. A great analogy is if anyone has ever seen someone squat with poor posture and they're hunched over and their knees are completely out of alignment, or they're even doing a bicep curl with just poor posture. If you don't have the proper posture and skeletal alignment, the muscles don't have the proper base to contract against. And that's why I really emphasize foot posture, set your base, and now let's activate our toes. Now let's do short foot, forward lean, single leg exercises, but it has to start off of that foundation.
Yeah, and I think what you're referring to is movement quality. We
Mhm.
can get an exercise sheet and see we need to do 10 squats and 10 this and 10 that, but reading and doing, and if your default way of moving is habitually not from neutral or locked into one of those foot postures, then it's almost like learning, like you've had a stroke and you need to learn to get some connections through again. So it's more of a mental process sometimes, I see, to have that neural connection built to train that movement in that new space because it's not the default. So it's definitely repetition, but sometimes I see it's literally the client will say, I don't actually know what you're asking me to do. I don't know how to do that. I can see your foot doing that, but I don't know if mine can do that. And
Mhm.
so then I think that's where the sensory lighting up and stimulation can help them build that connection to a new movement, which is literally not hardwired in their brain.
Yeah, absolutely. And we have to think about movement literacy, which is what I call that. Movement literacy is like an onion, and that there's layers. And sometimes you're not ready for what was said or in a directive or an exercise. You're just, your brain or your nervous system just isn't ready yet to hear it or to feel it. And I know it sounds really crazy to describe movement that way, such as a squat. But
Mhm.
movement is complex and there's a lot going on. There's an awareness, there's alignment, there's your feet, there's your breath, there's your pelvic floor, there's right everything else that's coming in. And we have to do it layer by layer. And
Mhm.
then when you're ready, then you'll hear what it is and it'll make so much more sense at that
Mm,
time.
mm. And I think the body learns it better in an environment of safety
Mhm.
and fun. When it has an experience, even if it's not the desired movement, if it has a movement experience that feels safe and fun, then it drops its guard a little bit and it's more willing to expand into a new possibility. And yeah, so I think even that is an art as a clinician trying to instruct movement is, going at the pace and just having that eye to see what the body is allowing that's new and then, proceeding into that space. And yeah,
Mhm.
it's a joy to be a movement teacher, really, isn't it?
I love it. I love it. And I think every movement teacher should be a movement student themselves, which so you understand what the student is going through and you're just like, "Yes, I get the need and the desire to want to go a little bit faster." So, it's a fun exploration.
Yeah. Have you personally ever had any back pain?
Oh my god, I have a lot of back pain. I was a former gymnast. I was in a lot of hyperextension for years and years and years. So yes, I do.
You do. And have you noticed a benefit from sort of getting the feet connected and building the deep abdominals? Or do you feel perhaps from a neuromuscular strength perspective, you've ticked all the boxes, but, God forbid, maybe there's some emotional connection there or some, have you thought outside the box for your back pain?
Yeah, so I think the way that I've always thought with my back pain is one, understand structural. So just
Mhm,
what are structural issues that lie there?
mhm.
And this is going back, I'm 45. Can't believe I said my age, but I'm 45. And this is going back like to when I was 20, because
Okay.
my peak gymnastics window was 6 to
Ah.
19.
Mhm,
So, and the way that they taught gymnastics as a sport is a little bit different than they do now. They understand the effect of
mhm,
hyperflexion and, extension and all these things to the back and repetition over and over. And just what
mm,
does that do to the lumbar spine? I do know that my sacral angle is a little bit structurally off from
mhm.
just developmental with gymnastics. And then I have a torn right hip labrum,
Ooh,
which
ouch.
an MRI, so that feeds into the neuromuscular system locking down to try to protect the tear. So I
Mm,
deal with a lot of kind of that aspect. Um,
mhm,
what I have learned through low back pain, chronic low back pain and chronic hip pain is that it is about consistency. It's about the patience in the ebb and flow. And
mm,
some days are going to be amazing. And then some days are a little bit more triggered. There's some where it seems like it's quiescent and then it kind of comes back with it. I travel a lot for work, so I understand
mhm,
what my triggers are.
mhm,
And my foot type, because you had kind of asked around that, is I have a higher arch, little bit stiffer just by design. So it's more of a cavus foot. And I understand the need for mobilizing from the ground up the entire system.
mhm,
But yeah, I've learned a lot in my own body.
mm.
And I've also had a rectus abdominis tear.
Oh, wow.
I have a plethora or a myriad of injuries in the pelvis,
Mm,
just athletics,
mm,
gymnastics. I was a competitive cyclist. And then when I was pregnant, I had really, really bad coccydynia
mm,
and or tailbone pain for the listeners. And it was very thrown off, I think, from just the history of my athletics. So
mm.
yeah, it's fun and there probably is some emotion in there that we discussed.
Well, well, we won't dive into that on a
All
podcast,
right.
but
Yeah.
I wouldn't do that to you. But that's brilliant. I think you certainly having the pain is almost like a way to internally explore things and connections that you teach about.
Absolutely. 100%, 100%. And then what I would say is movement is my therapy. So for any of my patients that I work with, I understand because some of them will have a tear in their plantar fascia that I'm trying to take care of, or it's chronic Achilles tendon, whatever the chronic condition or presentation is.
Mhm,
and it's confirmed that there's some structural changes on it, right? So I'm dealing with them on the structural.
Mhm.
Is they're like, Dr. Spickle, I need to move. Like my mental sanity, I have to do this. Like I have to be able to get my heart rate up. I get that as a former
Mhm.
athlete and someone who uses movement as therapy,
Mm.
that I can completely relate to that persona that needs that, to just have some kindness into the space of it.
Oh, for sure. And I think I go back to Joseph Pilates and his philosophies about there's always a way to move. No matter what's going on, you can find a way to move. And, but what I notice is there's a resistance sometimes in that person to pivot or shift from their mainstream way of moving and to explore something new. And the
Mhm,
irony is, and one of my podcast guests, Louisa Cruz, comes to mind. She was a yoga teacher, got a really nasty L5S1 spondylolisthesis from too much hyperextension, and
mhm,
just kept wanting to be a yoga teacher. Just loved it, just wanted to keep doing it, but
mhm.
could not. Kept bashing her head into that, "I'm not changing, I'm not changing," and eventually her back disabled her, and she went into swimming for rehab purposes, really didn't want to, resisted it on every level, finally got in the pool, and now she's like a competitive swimmer, doesn't do yoga anymore,
Wow.
and just loves it, and I see that time and time again that our bodies are nudging us in directions, but the ego is resisting a lot, and it's a really this connection that we have with our body is that relationship is everything, and I think with the foot, you see a lot of chronic conditions,
Mhm.
and I see a lot of chronic conditions with the feet in runners as well, and they just refuse to stop, even for a short period of time, and to pivot, and that in itself can be a key mirroring of my ego wants more than my body does right now, and
Yeah,
I can't accept that. So
yeah,
I think that's for that mental emotional overlay can keep people stuck in chronic cycles they just don't need
totally.
to be in.
Yeah, absolutely, absolutely.
Yeah. Okay. Well, when I say bulletproof backs or building a bulletproof back, what do you perceive as a bulletproof back?
Well, considering I love to talk about bulletproof feet,
Oh, do
I'm going
you?
to
Didn't know
bring
that.
I do. I love everything being bulletproof. But yes, bulletproof your feet and bulletproof your back, everyone. So to me, and why I think that this is great is that I'm going to answer it very similar to the way that I think of bulletproof the feet, because we want to bulletproof our body, um, is that first there is a deep appreciation for the structure and the role of the back, right? Lower back, in this case, we'll say, where to me, part of that would start and say, I want to um, honor, respect the uniqueness of the human pelvis and lumbar spine and the SI joints, and that they are designed, like lordosis as an example, is a critical part of how we are able to stand up on 2 feet, how we're able to walk that the way that we walk with these long steps and contralateral movements, and we can transfer energy. So having an inherent appreciation, I think, is really, really important. Then it is understanding the interconnected nature of the structure here, what's that lower back, how it's connected and it talks to and is deeply integrated with the T-spine, with the
Mhm,
feet, with the
mhm,
jaw, with everything else that kind of radiates out, and how we need to bring that appreciation into simple habits that are part of a lifestyle. So I'd probably argue that bulletproof backs, and you'd probably argue as well, to have a bulletproof back is a lifestyle, right? That
mhm,
you are appreciating it, you are doing small habits that focus on sufficient mobility, sufficient strength, um, sufficient circulation and sensory stimulation, just every aspect of what it means functionally and emotionally. Is That's a lifestyle that
mm,
part of what we have to embody and created in small daily habits that we are doing consistently to create that bulletproof back.
Mm.
Um, so that's how I would.
I love that. What you didn't say is it's all about your six-pack abdominals, which is the
Well, I know.
misconception out there that you can strengthen your way out of back pain, and I think you can. I think some people can for sure. But yeah, I see a lot of people trying and failing and then feeling even more miserable about themselves because, they've got one piece of the puzzle, and this system of ours needs a lot more than just some nice strong abdominals or nice feet for that matter. I mean, they're all parts that help, but we're a lot more than our structure. But the structure's got to be right. And
Yes.
I sometimes think the structure reflects more what's going on the inside than the other way round.
Hmm.
But I think it's probably unique and individual to who we are and where we're at on our life path. So yeah, it's being able. I like that definition, is what I'm saying. Now, tell me about NABOSO and the products range that you have. I've been watching your company for several years now, and the insoles were like a game changer for my work with my clients. And then I get excited every time there's a new product drop. I'm like, oh, now we're doing hands. Oh, now I get quite excited. So tell me about NABOSO and, where some of the listeners could find some of the products that are going to help them.
Absolutely. So I will show you. This is our sock. This is the inside of a sock, just so people can see what the texture is.
Hmm.
So all of the products at Naboso have this same pattern. So they're little tiny pyramids that are across every single product. This is the inside of the sock. This would be the top of an insole, so you can see the texture. And what those pyramids are doing is they're stimulating the nerves in the bottom of the feet and the palm of the hand. So, yes, we do have the hand products. And our goal through this texture, this patented texture, is that we are targeting a very specific nerve that is talking to the brain to tell you first where your feet or hands are relative to your body. So
Hmm.
it's the perception, the awareness of hands, feet relative to self and external environment that controls balance, posture, function, movement, athletics, rehab, etc. Then you could go a little bit deeper and say that sensory stimulation activates muscles. So we are strengthening these structures. We're strengthening our feet, strengthening our hands, our foot to core because they're connected. And then texture also increases circulation. So that's where you could focus on the recovery side. So all of the Naboso products, we have over 40 products, and we have 3 more that are launching through the end of the year, so
Oh, that's
more fun
exciting.
stuff for you, yes. Um, is all of them are focused around awareness, strength, or recovery. That's how you could think of any of the products is, do I wanna build awareness? Do I wanna feel my feet, feel my hands? Do I wanna strengthen my feet and hands, or do I want to recover my feet and my hands?
Yeah, and I love the socks and the insoles for, I have clients that I do suggest barefoot movement
Mhm,
outdoors, but they're, for whatever reason, maybe they're old and they're in a nursing home and that's just feels too difficult. So they can put the socks on and they can wear the
mhm,
insoles. Or, you're a corporate person in an office job. You can't, I mean, we are in Australia and we do like to be barefoot, but
mhm.
there is a limit. There's places you can't go barefoot. So I think it's a lovely sort of way to get around, to get that stimulation without having to get your shoes off all the time.
Yeah, no, absolutely, thank you.
Congratulations on all that you've built. Congratulations on the knowledge and I guess the education you're offering to movement enthusiasts, practitioners like myself. No doubt your clients benefit immensely from what you do. And yeah, where can listeners find? You mentioned Barefoot Strong, but is NABOSO a separate website? What are the websites that people can go to learn more about what you do and what your products are?
Absolutely. So I do see patients virtually. So if there's any interest on second opinions, functional podiatrists, chronic presentations, just know that I do that. That my website is thefunctionalfootdoc.com. That will go to my practice. And then for any of the Naboso products would be naboso.com, naboso.com. And we do have distribution all around the world. So we do run distribution in Australia for the Australian listeners.
Brilliant.
Um, and then I have 2 books that are out that are available on Amazon. So I have Barefoot Strong and sensory sapiens. And both of those explore what we were talking about, your feet,
Mm.
sensory, foot to core. Sensory sapiens is my latest book that goes a little bit deeper into fascia, the emotion of fascia, gait, walking speed. So a lot of fun stuff. And then, of course, everything on Instagram.
And don't forget your podcast, which is
Oh,
kicking off
yes.
and
Yes.
I've really
What about
enjoyed the episode so far. Yeah, I think again for movement or practitioners, even if you're not a practitioner, Emily's got this podcast that's kicked off and she covers some really interesting topics. I certainly learn something every episode, which is what I'm thirsty eternally for: new knowledge, new insights, new
you?
connections. That's what it's all about.
Yes, no, I'm excited for your episode to be on. So it's called Root to Rise for the listeners. So Root to Rise. And I'm excited for your episode that should be in a few weeks.
Whenever.
Yeah.
Hey, thanks for your time. I know you're a busy lady, and yeah, it's the end of your day where you are. It's the start of my day where I am. So we've had that little cross section and intersection. Thank you again, Emily, for all that you've shared, and
Thank
we'll
you.
chat soon.
Okay, thanks.